Hello everyone. Today we are going to read larynx. So in larynx we have certain cartilages, paired and unpaired cartilages. So cute is the mnemonic for unpaired cartilage, and ACC cement is the mnemonic for paired cartilages. So U stands for unpaired. In cute, U stands for unpaired. C and T, that is cricoid and thyroid, is hyaline cartilage, and E for epiglottis is elastic cartilage. E for E, epiglottis is elastic cartilage. And in paired we have ACC. So A is arytenoid, C is corniculate, and C is cuneiform. So here A, arytenoid, is hyaline, A is hyaline, and CC is elastic. So in this cute, first two C and T were hyaline and E was elastic, and in paired ACC, A is hyaline and the rest two is elastic. So hyaline, elastic, hyaline, and then elastic. Now coming up with the pathologies. So first of all, this is an image of laryngocele. This is the image of laryngocele. It happens in in person playing trumpet. Trumpet, you say no, popu bajate hain. Trumpet players. There is a Brace sign which is positive in these patients. Brace sign, which is a gurgling sound produced on pressing the swelling. So it is positive over here. And it happens due to enlargement of saccule. Saccule is the part of larynx, so it happens due to enlargement of saccule. The endoscopic view is like this. So this is laryngocele. It can be present externally, and if it is present externally, it is through thyrohyoid. Now this was laryngocele. Now this is the image of Rinke's edema. Rinke's edema, also known as smoker's lung, smoker's larynx, sorry, also known as smoker's larynx. It causes diplophonia. It happens in smokers usually. So third one is, this is the image of swollen epiglottis. And the pathology here being discussed is epiglottitis. So in epiglottitis there is inspiratory stridor, tripod positioning. Patients usually sit in tripod position, and in X-ray we have this thumb sign. On endoscopy it's swollen epiglottis, and on X-ray we have thumb sign. Treatment is antimicrobials. Usually IV ceftriaxone is given. Clinical feature is toxic looking child, with drooling of saliva. Also, there is a hot potato voice. Many of these are PYQs, like thumb sign is a PYQ, IV ceftriaxone is a PYQ, inspiratory stridor is a PYQ. So very important topic for NEET as well as for AIMS. Now this is steeple sign. This is the image of Croup. In Croup we have biphasic stridor. Biphasic stridor. It is of slow onset. This disease is of slow onset. This was acute onset. I forgot to tell. This was acute onset. Symptoms usually presents within a few time span, and this is slow onset disease. Here it is barking cough or seal-like cough. X-ray showing steeple sign, or it is also called as pencil tip sign. Management is, in mild to moderate cases, it is nebulized epinephrine, racemic epinephrine nebulization, racemic epinephrine nebulization, and in severe cases, steroids, dexamethasone. So causes of Croup is parainfluenza virus, parainfluenza, and RSV. So now this is omega larynx, omega shaped larynx. This is the image of laryngomalacia. Laryngomalacia. Inspiratory stridor is present. It is overall the most common cause of inspiratory stridor. This inspiratory stridor increases on crying and decreases on prone positioning. It occurs usually in child. There is a most common congenital anomaly of larynx. It is the most common congenital anomaly of larynx. Management is conservative. Just wait and watch, and assurance to the parents. Omega shaped larynx is a PYQ. Inspiratory stridor again is a PYQ, and it is the most congenital anomaly of larynx is again a PYQ. So now this is the image of subglottic stenosis. Subglottic stenosis. So subglottic stenosis, clinical feature is biphasic stridor. Biphasic stridor. Grading is Mayer Cotton or Cotton Mayer grading, in which grade 1 is up till 50% stenosis, grade 2 is 51 to 70%, grade 3 is 71 to 99, and grade 4 is 100% stenosed. So clinical feature is biphasic stridor. Along with that, intercostal retractions are also present. Intercostal retractions are also present. Management is mitomycin C is used. After the treatment, mitomycin is used for management. Okay, so now this is the image of juvenile laryngeal papilloma. Juvenile laryngeal papilloma. Juvenile laryngeal papilloma, or it is also called as respiratory or juvenile papillomatosis. Papillomatosis. It is caused by HPV, and clinical feature is chronic hoarseness and stridor. Chronic hoarseness and stridor, and respiratory distress occurs after 2 weeks. Respiratory distress occurs after 2 weeks. So this is juvenile laryngeal papilloma. It is another pathology similar to juvenile laryngeal papilloma. It looks similar like that, but this is a pathology of nose. It is a benign condition caused by HPV in elderly. Clinical feature is unilateral nasal obstruction, along with that epistaxis. So now this is vocal nodule. Vocal nodule. Vocal nodule. This is like vocal nodule. So it forms in patients or in person who do sound abuse, like who speaks regularly in loud sound as singers or teachers. Now this is vocal polyp. Vocal polyp. So this is vocal polyp. And one more thing I wanted to tell about larynx. So larynx have larynx, there is 2 types, adult and infant larynx. In adult larynx, the epiglottis is at the level, epiglottis is leaf shaped, and in infants it is omega shaped. Position of the larynx in adults is C5 to C6, and in this C3 to C4 is the position of the larynx. Narrowest part is glottis. Narrowest part here is subglottis. Subglottis. So I have a mnemonic. So what we read is epiglottitis, croup, laryngomalacia, and subglottic stenosis. So this is ECLS. ECLS. ACLS होता है ना, so it is like ECLS. ECLS, inspiratory biphasic, inspiratory biphasic stridor. So inspiratory stridor, biphasic stridor, inspiratory stridor, biphasic stridor. We usually get confused, so this mnemonic is gonna help. ECLS, IBIB. Okay, so one more thing. So we have parts of larynx. Parts of so you want to know that what is inspiratory stridor and where does it happens. So larynx, there is a part supraglottic region. Supraglottic region, if a stridor happens in this area, it is inspiratory in nature. If it happens at the level of it happens in the at the glottic level, which is located at the level of vocal cords, this is biphasic stridor. If it is located at subglottic, it is also biphasic. And if it is near the thoracic outlet, thoracic trachea, it is expiratory stridor. It is expiratory stridor. So this is it. We have two mnemonics. First one is cute and ACC. Rapidly revising up, we have two mnemonics, cute and ACC. Cute is for U for unpaired cartilage, C and T is hyaline, E is elastic, A arytenoid is again hyaline, C is elastic. So hyaline, 2 hyaline, 1 elastic, then again 1 hyaline, 2 elastic. This is cute and ACC. Now it's ECLS, epiglottitis, Croup, laryngomalacia and subglottic stenosis. Remember, in this sequence only, ECLS like ACLS, it is inspiratory, biphasic and inspiratory and biphasic. Usually these four are asked and we get confused, so this is the mnemonic for this. And one thing I forgot to tell, that the apex of arytenoid is elastic. This is exception. Apex of arytenoid is elastic. So this is it. This is vocal polyp. Okay, thank you.